I'm Roy Steigbigel in the Division of Infectious Disease at Stony Brook University here. I came here in 1983 to establish the Infectious Disease Division in the Department of Medicine. I was at the University of Rochester in the Division of Infectious Diseases, and in 1982, Harry Fritz, who chaired the Department of Medicine here, called me and asked me if I'd be interested in looking at the position to start establishing the Infectious Disease Division in his department. So the hospital, when I came here, had less than 200 beds. In contrast to now, it's over 600. So it was in the development stage. And a lot of the clinical care was given, the residents spent a significant amount of time at the Northport VA, as well as here. But the Northport VA, actually at that time, probably had more patients than we did. So it was a rapid evolving of the patient population here. And it was the only university hospital in all of Suffolk County. So there was a growth of population in Suffolk County with a great need for establishing a university hospital. So it was a confluence of two needs which worked out quite well. The original dean, Marvin Kushner, he came here from New York University, and he had a large portfolio or large support from the state. And he very wisely, recognizing the clinical enterprise initially was not good, to invest in absolute excellence in the basic sciences. And I think that's very important for everybody to recognize, because the basic sciences here, in some particular areas, such as immunology, microbiology, were really superb. Some of the original people who came here were among the best in the country, and they were attracted to come here. And they had the resources given to them. And Marvin Kushner was brilliant and able to do that. And I think that's something maybe often got forgotten. So the excellence of the basic sciences carried over to an expectation of excellence in clinical, which was not as important in the original establishment of the institution. I was intellectually interested in the immunological aspects of infectious diseases. So that's why I was attracted to work in the HIV area, as well as, of course, seeing the absolute need for such work. So in 1983, the epidemic was increasing in numbers of people, and the number of individuals who were coming to our hospital was also increasing. So I saw the need to establish an area in the hospital where the patients would feel as comfortable as possible, but of also great importance that the caretakers were. So there was still a lot of concern and fear among some of the nurses and other people caring for patients that HIV can be acquired with more casual contact. What was known not to be true, but it wasn't as well accepted. So the 15 South was the floor in which we started the AIDS Center for inpatient care. We utilized a floor which hadn't been opened yet. So we were able to establish a floor where all the people with HIV could be hospitalized. And we did some special arrangements to make it better in terms of infection control. For example, the sinks were only in the rooms. We wanted the personnel to be able to wash their hands without having to go into the rooms. So we actually had sinks installed in the hall, which was the first part of the hospital to have sinks established in the hall. So the Infectious Disease Division, which I established in 1983, took on, obviously, responsibility of caring for people with HIV. And being a university hospital, it was obvious a necessity to combine excellent care, as much as it could be excellent, with investigation and research. So we had that two-pronged, or really three-pronged, so to speak, patient care, education, and also research. And shortly after I got here, we were able to establish ourselves as one of the original HIV treatment centers funded by the National Institutes of Health. NIH decided to fund special centers for HIV care and research. And we were in the second wave of that, and we got funded about, I think, in 1986. And our funding lasted for many years. It amounted to over $10 to $12 million over that period of time. And that allowed us to participate in, obviously, care, but also research. Research from this group called the AIDS Cooperative Treatment Group. as well as our own individual studies, which we did. And we had the first major publication, one of the major publications, the New England Journal of Medicine, for one of the first major used integrase inhibitors called raltegravir, which is produced by Merck Research Laboratories. That was an important part of the development of the institution, to show ourselves as an institution that could participate in these national studies. Obviously, there were others going on. The immunology division had already shown itself to be very prominent, and also, of course, the hematology was very strong at that time, the hematology division. So we participated also in these national studies funded by the National Institute of Health, but also by industry. By industry, I mean there were some medications that were being tested, and they had to be determined whether efficacious as well as without toxicity. And industry funded those studies to determine whether those two things were true, efficacy and lack of toxicity. So we had funding from both the National Institute of Health and from industry. So it was a very vibrant and dynamic time with a lot of exciting developments in terms of new therapies, which were evolving all the time, and participating in the development of those. So it had a lot of aspects which were very pleasing, but it was also a time of sadness, because we got to know some of these patients quite well. And in the early years, we couldn't do all that much, and we really helped them pass through life. But now, of course, we are involved with COVID, as almost every infectious disease physician in the United States and across the world, by necessity. We have had various number of people hospitalized during the peak. I think we had over 350 people with COVID in the hospital, and it required a lot of readjusting of rooms, which was really done in a phenomenal way by those who carried that out, so there could be proper isolation. And the numbers have waxed and waned with the national and more appropriately the figures in this community. Well, I think it's always been a place that always felt young, which is very good, because it was always a desire and the need to do better and to expand our efforts in the three primary areas of a university hospital, that is investigation, clinical care, and teaching. And I think that each of those areas expanded over time. The people who came here wanted to participate in that area, and many succeeded in accomplishing those goals.